Hello, my name's Rob Webster. I'm Chief Executive of South West Yorkshire Partnership NHS Foundation Trust. We're an organisation that exists to help people live well in their communities and fulfil their potential. To do that, we have to move with the times and we have to embrace the context that we operate in. That's one where change is essential and transformation can improve the lives of everybody we work with. We've been working on large-scale change for some time because we want to make the biggest change that we can and the biggest difference that we can to the most people that we support.
Creative Minds is a charity hosted by Swift, and what we do is we help to facilitate and develop creative projects that help to improve the health and well-being of people who use Swift services. The large-scale change we wanted to achieve, I suppose, was cultural change. The medical model within the NHS, I suppose, as fixed ideas, fixed ways of working, and creativity was seen as soft and fluffy and not really something that could deliver recovery and larger scale change.
I came across Creative Minds by chance. I was quite ill at the time. I was heavily medicated, often bedbound, and my children were my carers. I'd reached rock bottom and I had no hope. I'd been told by the professionals that I'd always be ill, I would always be medicated and I'd never work again. And I decided to do this art class, Art for Wellbeing, and never realised that such a simple art class could change my life in the way it did. In the 7 years that I've done it, I've been off medication for 6.5 years. I've been out of services for 2.5 years. And I'm off benefits for the first time in 14.5 years, working in the same trust that professional who told me I'd never work again for works in.
We did early on identify that how we were operating was more of a social movement, more of a living kind of way of working that would get passions going for people, and we got staff as champions, we got service users and carers as champions, and they told the story, they conveyed the change. We've got 120 plus partners, different creative organisations that weren't used to working with the NHS. So we've got a system where we can work with them much more freely now, and they embrace that kind of approach. Creative
Minds is hope. It's about giving people hope. In a system that doesn't really give you hope. And it's life-changing. It's certainly changed my life, it's changed my daughter's life, it's changed the community I work in's life.
To make sure that we improve and achieve our aim to be outstanding, we need to ensure that we support people to make the changes that are necessary. That means we need to have the right culture and the right infrastructure in the trust to make that possible. The way that we're approaching that is to put change right at the heart of our strategy for the future. And that means that every person in this organisation can feel that they're empowered to see a difference and make a change. That means that we do need the right culture and the right infrastructure of support. I'm really pleased that we were asked to contribute to the guide around large-scale change in the NHS, because that's part of the infrastructure that's required to make the difference that will see us deliver sustainable services now and into the future.